In this video, I would like to take everyone to Japan and South Korea and 3 stories of stomach pain. None of them have stomach problems. Can you guess what the causes of their illness are? A 56-year-old woman presented to Korea's Busan hospital with a 1-week history of right epigastric pain. Physical examinations revealed severe tenderness over the epigastric area. Blood tests showed deranged liver function test. Abdominal computed tomography and magnetic resonance imaging showed a 6.5 times 6 cm ill-defined mass occupying the left lateral segment of the liver. The patient then underwent a left hepatectomy. Following, in Kashiwa, 1 hour from Tokyo, a 71-year-old woman visited a local hospital with the chief complaint of epigastric pain. Abdominal CT revealed a large cystic mass in the liver, measuring 69 mm in size, and a wait-and-watch approach was adopted. After 2 years of follow-up, the CA19-9 level, which was within normal range at first, increased to 188.5 unit per milliliter, and CT revealed an increase in the diameter of the cystic lesion to 91 millimeters. She was then referred to the surgery department of the National Cancer Center Hospital in East Kashiwa. However, the cystic mass had gradually increased in size and become systematic. Therefore, left segmentectomy of the liver was performed. Pathologically, the cyst was lined by columnar and cuboidal epithelium with low-grade atypia. The diagnosis was mucinous cystic neoplasm of the liver with low-grade intraepithelial neoplasia. The post-operative course was uneventful, and the patient was discharged from our institution on post-operative day 10. At present, 6 months since the surgery, the patient remains alive with no evidence of recurrence. In Shinjuku, Tokyo, a 46-year-old man with human immunodeficiency virus infection presented with epigastric pain. He had a history of right shoulder pain 2 weeks ago, but his blood test showed high white blood cell count and mild deranged liver function, with ALT being 64 units per liter and ALP being 148 units per liter. Contrast-enhanced CT revealed a liver abscess in the right lobe of the liver, and amoeba histolytica ambiasis is found in his blood test, with stool and liver abscess aspirated, and he was then treated by antibiotics. The patient showed progressive clinical improvements. At the follow-up 5 days later, his CT showed liver abscess shrinkage, while at this 3-month follow-up, CT showed complete resolution. No recurrence was observed during the 6-month follow-up period. Liver diseases often have no symptoms. However, the liver is located next to the stomach. Sometimes liver disease, especially in the left lobe, can cause upper abdominal pain. Even though gastroscopy can access the esophagus, stomach, and duodenum, it cannot examine other organs, including the liver. On the other hand, imaging of the upper abdomen can investigate the organs around the stomach. However, scanning might not always be the best test for examining the stomach or colon. In the case of hepatitis, blood tests might be more helpful. Regarding stomach pain, the type of test varies depending on the patient's condition. In this episode, we visit medical centers in Japan and South Korea to explore 3 people with stomach pain. They initially thought it was a stomach ailment, but it turned out to be liver-related diseases, hepatic cyst, liver cancer, and liver abscesses.